really excited to talk to you briefly about this because I think it's so confusing, right? From a patient standpoint, here you are being told for years of how important sunscreen is, and then all this kind of confusing information in the news about whether or not they're really safe or potential contaminants. So I think it's really important that we address those concerns. This whole kind of controversy hubbub started in May when there was a private company called Valisure, a pharmacy, that looked at sunscreens, and they used really precise tools examining the contents of these various sunscreens, looking for contaminants and impurities. And this independent company identified some sunscreens that contain a compound called benzene. Now, benzene is actually something that we likely already come into contact with in our daily lives. It's a component of gasoline. It's used as a solvent for rubber and waxes. It's in the air from vehicle exhaust and those kind of things. So it's likely that we've already come into contact with benzene at some point in our lives. Benzene is a known carcinogen, however, and it's regulated by the FDA in things like soft drinks and hand sanitizers, and they have regulations about how much of this compound can safely be ingested or exposed. How much we can safely be exposed to through those means. But there's currently no set concentration limit of how much benzene is allowed in sunscreen products. So at this point, what the FDA is doing is just getting more information, seeing how many sunscreens could potentially be, contaminated with this potential carcinogen, and exploring those products further. Most of the products that seem to potentially contain this benzene contaminant are aerosol sunscreens, so the spray sunscreens. And while, again, this may be a theoretical concern that needs further evaluation, the amount of sunscreen you'd likely be inhaling from something like even a spray sunscreen that could contain this contaminant would likely be pretty low. And again, it's unclear how much of it would even get into your body through inhalation from sunscreens. So there's just a lot of confusion about this. What I think is important to emphasize is that while there are these theoretical concerns, and there's some actions that I think we can do as consumers to safely continue to use sunscreens, what I think is critical to emphasize is that sunscreens as a whole are overwhelmingly safe and so important in protecting against ultraviolet radiation, which we know can significantly increase the risk of skin cancer. Now, in terms of skin cancer, we know that more people are diagnosed with skin cancer in the United States each year than all other cancers combined. And using sunscreens is an effective means by which to prevent those skin cancers. And this has been reproduced through multiple studies over the last several decades. Sunscreens are not the only tool that we can also use to prevent skin cancer. Covering up, using hats, wide-brimmed hats, sun shirts, and sun clothing that has what's called a UPF rating, avoiding the sun during the peak hours of 10 to 2. All of those are important, tools in addition to sunscreens that we should all be using to mitigate our ultraviolet exposure and associated skin cancer risks. Kind of takeaway messages, if I could. I think One thing, if you just want to be extra cautious, perhaps just avoid some of these spray sunscreens. There are some of these sunscreens, especially by Johnson and Johnson, that have been voluntarily recalled while they're just exploring this in further detail. We at Dermatology Consultants don't carry any spray sunscreens currently. We do, however, have a product line called the Elta MD um, sunscreens that come in lotion form, which were actually evaluated by this same company that initially released these results in May. And none of those products that we carry, the Elta products, have any of this potential contaminant in their testing. So that's an excellent sunscreen resource. And again, I would very much encourage our patients to continue to use these sunscreens as part of their sun mitigation strategies.